history, Newman was the first man, but I met this man, Manjo. He provided me some expander, and he was very helpful to me, and I did
We have some points, please.
1946. The basic philosophy of tissue expansion is to provide additional tissue of similar nature to areas of need and leaving the donor site reserved. Next. Next slide. It can be applied anywhere in the body. Next. I did about 9 cases with 11 sessions of tissue expansion. You will be surprised to know I did 6 cases in 1986-87 and rest of the other 3 or 4 cases in 20 years. Next slide. Clinical application, 9 cases were treated and 11 sessions were done in these cases. Next slide. Now the advantages are provide tissue of same color, texture and sensation, provide tissue of special features, keeps the donor area preserved. Relatively simple and straightforward technique. Next slide. Expander can be left as an implant, which is used in breast reconstruction. Expanded tissue more reliable in vascularity. Next. Now there are various disadvantages like relatively lengthy procedure, 2 to 4 operations for each reconstructive problem. Additional cost of expander, patient inconvenience, and patient also surgeon's tolerance. Next. Evaluation, no mechanical failure, no infection, no extrusion, tissue generation sufficient in 7 cases, tissue generation optimum in 2 cases. Next slide. This was my first case, 6-year-old girl with giant livers. Next. About 620 cc of expansion was achieved. Next slide. This is the result. Next. There was a second case where there was a post-traumatic defect here, post-surgical defect here. Next. This is the result. Next slide. Then I started using expander for hair transplantation. I did about 3 cases usually flat. And you can see excise the skin here and transpose this flat, and you can have a good amount of hair in the front part. Next slide. This is also usually flat. Next slide. Now this is my last case where I expanded this skin on the nose. Next slide. Here you can see the expanded nose. Rather expanding the forehead. So you can avoid a lot of scarring if you are expanding the nose. Next slide. Here you can see immediate post-operative result, but he has some problem in the columella. Next slide. Yes, it is video. This was my first case. And probably the first case in this country because it was done in 1986 at 7. This paper also I presented in Madras in one of the meeting of the Royal College of Glasgow. Here you can see the total amount of expansion. This is extrusion. And you can see the skin was removed and the flap was set. This is my last case. You can see this is the amount of skin, and I expanded the nose skin rather than the forehead. You can avoid a lot of scarring. And probably I haven't seen anything in the literature about expanding the nasal skin. Probably Dr. Mangun will say something about it. So these are various flags for design. And here the amount of skin you can see, a lot of amount of skin you can shift it to the torn part of the nose. This is immediate post-operative result. Next slide. This is the only reconstructive procedure which has the highest cosmetic value without any donor area mobility. Thank you. Thanks.